Alright, hi everyone, Aksara here. If you're watching this video, first of all, say hi to us or to me. My sister's actually in the background, so I can say hi back to you and let me know what is that you need help with, okay? And while we following our page. So anyway, what I want to talk about right now is first of all about a current client who's a nurse, and we've been working with her on her Sjogren's autoimmune recovery. And I wanted to share with you the kind of progress that she made. So she's a nurse, and her symptoms, her Sjogren's autoimmune symptoms, have been gone in 21 days. So before we started working together, she was dealing with muscle and joint pain, stiffness, tingling, and numbness of extremities. She had extreme dry eyes and pain. She had difficulty swallowing. She felt like food was hanging on her throat for hours. And she had brain fog, dizziness, sinuses, headaches, fatigue, body weakness, and joint pain. She also had constipation and abdominal pain. And all of these symptoms have been gone in 21 days. And the interesting thing is that prior to being diagnosed with Sjogren's, she was having the symptoms for 4 years. And she was eating very healthy all of her life, but she still got an autoimmune disease. And she was really upset. She's a nurse. She couldn't do her job because her fingers were hurt and it was difficult for her to draw blood from her patients. So she went to see a rheumatologist, and that's how she received the diagnosis. And the rheumatologist was going to give her steroid medication to treat her symptoms. But there's so many side effects with these steroids, and she knows all about them. So if you want to hear more about her story and her recovery, where she can teach you about these steroid medications and what the side effects of them, as well as how you can get to full disease reversal and be able to even avoid the medications or get off of them, then comment under this video and I will share this video with you. And what, Victoria? Yeah, so can you give me like, I don't know what my sister's telling me. Hi, Molly. So again, if you're watching this video, then let me know if you here. Okay, so again, like I mentioned, if you want to see that video with a client who was diagnosed with Sjogren's and her recovery, and she will teach you about the steroids and the side effects and how you can get to full reversal. And she also talked to one of her patients. So 4 out of 6 patients that she sees deal with some kind of autoimmune disease, and she's been able to share her progress and her results with working with us and inspire other people that they can get better. But she talked to this one particular patient who was diagnosed with colitis, and this patient invested twice into natural healing. Unfortunately, this patient who's been dealing with colitis invested into somebody who didn't take care of her, and she still has her disease. And so now her husband is really skeptical, and she doesn't want to get her, or he doesn't want to support her with another type of approach because other people haven't been able to help her. So it brings me back to this point: be careful who you listen to for your disease reversal advice. And who do you get your advice from? You can actually get sicker by doing something wrong or by taking wrong advice. So every time somebody tells you to eat something or to do something for your disease, you have to ask how many people have this person reversed autoimmune disease for as fast as 6 weeks. Okay? So otherwise, it's very dangerous for you to get this advice. So if you want to hear more about a client who's a nurse and the type of recoveries she has seen, then comment under this video and I will share it with you. Another thing I want to talk about is Hashimoto's, because a lot of people come to us for Hashimoto's disease, okay? So a lot of people, my sister, Victoria, can you stop distracting me? My sister's in the background and she keeps distracting me when I'm trying to do this video. And so a lot of people come to us for Hashimoto's recovery. And so we helped a lot of people reverse Hashimoto's. And in Western medicine, they don't do much to treat that besides wait for the thyroid to die. So they tell you to just take thyroid medication, take thyroid hormone pill, and you never need to worry about it again, because once the thyroid is dead, you don't have the illness anymore, except that you do. Autoimmune disease that has destroyed one of your organs, such as in case your thyroid, does not mean that the disease is gone. It just means that autoimmune disease does not have that target anymore. That is why people with Hashimoto's later start developing arthritis and all sorts of different diseases and symptoms because they still have an inflammatory illness. So to get rid of Hashimoto's, you can't just take thyroid medication for it. It doesn't fix the problem. You have to address the inflammatory disease and get rid of that before it continues to cause other problems for you. So inflammatory illness is like a forest fire that is out of control. So there are constant sparks flying that are starting new fires. That is also why our program is the most aggressive approach for disease reversal, because if you have out of control fires going on, you can't just take a glass of water or try to put down that fire. You need airplanes, you need the trucks, you need to surround it and come out of it at different areas. So we need to attack the disease at super high levels to get rid of it. So if you have Hashimoto's, you have a big forest fire, and you have to address that at the root level and treat the autoimmune disease and change the way your body functions so it stops producing the attack on your thyroid. And the question that we get asked is how much thyroid function you have left after you've had Hashimoto's, maybe for years or decades. It really depends. If your body has been attacking your thyroid for years, some of it is inflamed and injured, and it will heal in our program. And those areas will heal and recover. Some areas are destroyed and there's a scar tissue. So scar tissue no longer functions. So some people we worked with, they no longer needed their medication. They were able to get off their thyroid medication. Other people we have worked with had dramatic reduction of medication, and they continue to reduce the need for thyroid hormone. And some reduce it and some get rid of it completely. And some people have Hashimoto's for decades before they work with us. And even if they still have to take the medication, their pain goes away. They no longer are overweight and they no longer have the symptoms of Hashimoto's. And they're full of energy. So even if you can't fully recover your thyroid function because you've had the disease for decades, you can reverse the disease process and you can start feeling good again. It is one of the most common autoimmune diseases people come to us for, and we had really good results reversing Hashimoto's for people and helping them get off their medication or reduce the need for thyroid medication. So we make changes in people's recovery almost daily when we work with them. And if you're not doing it with us, what are the chances you will fully reverse your disease? And it's not going to be rapid without a daily support and education. So we're able to spot issues and solve problems to make sure you're doing it correctly. So that's why a lot of people come to us. They try all kinds of diets. They're eating really, really healthy. Like I mentioned with a client who's a nurse, they still have an autoimmune disease. So when you do the right things for an autoimmune disease, it also the right thing for your blood pressure. It also the right thing for your hair and your skin. Whatever it is helping your body get as healthy as possible. And it helps with all the issues, whatever you have, whether it's lupus, diabetes, your body needs the tools to repair itself. So nutrition accelerates cellular recovery and repair an anti-inflammatory immune system. That's what we teach you how to do. And a lot of people get it wrong because they're getting advice from other people who teach you something that they learned in 1999. So everything that we teach is new information. It's new. It's not something you could find or read online. And so another thing that we work on is accelerating your metabolism, makes it easier for you to gain muscle, and it makes you easier for you to recover from a flu or cold. So instead of being sick with a cold for 2 weeks, you get sick for 1 day. Because you're optimizing your cellular function in a program. When we work with people, we teach you how to do that. So everybody will do better by optimizing their cellular function. It also slows down your aging process. Who doesn't want that? And also, so you don't need to also wait for you to get a diagnosis. How about you never get a diagnosis? So sometimes people ask us, do I need to get a diagnosis to start working with you? You don't need to do that. Hi, Michelle. How are you? Hi, Eliana. Hi, Lillian. Hi, Molly. Good to see you. Yes, so that's what I talked about. In the beginning of this video, I talked about with a client who's a nurse, and she reversed all of her Sjogren's autoimmune symptoms in 21 days. And she talked about the medications, why she refused to take the steroid medications and why it's not a good route for anybody and the side effects with them. And also she talked about why she decided not to do stem cell therapy and why she decided to work with us instead, and how she was able to get to full disease reversal where her symptoms are gone, completely gone in 21 days. And also in the second part of this video, I talked about Hashimoto's, how doctors, they just treating the symptoms, but they never reverse the autoimmune disease. So the disease progresses and continues to cause problems. That's why a lot of people who have Hashimoto's, they develop other autoimmune disease because they never fix the autoimmune disease. They never fix the immune system. And so what you need to do is you need to fix the immune system, address your symptoms, and reverse it, so that way you no longer need to take the thyroid medication. And another thing I want to talk about is multiple sclerosis. So we had really great results with MS. We had 2 other people in our program whose newest lesions went away, which should not happen in Western medicine, but it has. And we had someone who eliminated all MS symptoms as well in our program. So you can absolutely reverse MS, but can you eliminate all damage that's been done to your central nervous system? And that's related to your individual situation. So are the neurons that are completely dead, or the neurons that are just inflamed, they can get better. And that is just like those new lesions have disappeared on MRI, but the old lesions are still there because there's a scar tissue now. So what we teach you again in our program is to completely reverse the inflammation around the nerves so the nerves can repair. And that's what with our clients with MS, we've seen the newest lesions disappear, and then they no longer had new formations of lesions. So that's really important, is that you stop the disease progression and you completely reverse the inflammation, allowing your nerves to repair. So you can stop the progress, the MS progress, and you can reverse the illness, and you can put out all this fire so you stop spreading the disease from progressing. And we had really good results with MS as well. So if you know anybody who's struggling with that, have them reach out to us so we can see how we can help them, put them into the best rapid recovery possible. And the final thing that I want to talk about in this video, so let me know if you have any questions about that. Hi, Nola. Hi, Andrew. Let me know if you have any questions about anything I just talked about. Another thing I want to address is people sometimes get hair loss and they wonder why they're having hair loss. So hair loss is caused by inflammation or stress, but oftentimes it can come 3 months or more after you had an injury or that issue happened to you that caused you to have hair loss. As some of you may know, people who were infected with COVID virus, they started having hair loss months since they had the COVID. So a lot of times people think that something that they doing is causing them hair loss, but actually it could be the injury or something that they done 3 months prior to that, and now they start developing hair loss. So that's why we had clients who were completely bald and now the hair started growing back because we addressed the inflammation that caused them to have the baldness and the hair loss. So make sure that you're also supporting your thyroid the right way if you are experiencing hair loss and getting to the root of your symptoms, and you can get healthier all at the same time. So when you're doing something to help address your autoimmune disease, everything's supposed to get better. Your hair loss, your symptoms, your joint pain, your skin, everything's supposed to improve. You're not supposed to get sicker and get healthy at the same time. Okay? But also important thing that I just want to mention is that some people have hair loss 3 months since they had an injury that caused them to have that hair loss. But it doesn't mean that something they're doing right now is causing it to them. So make sure that you know and you have that experience and understanding to understand what is it causing you to have your symptoms and how you can fix it the best way possible. So reach out to us if you're dealing with any autoimmune disease symptoms, or if you're dealing with autoimmunity and you've been trying to figure it out, but you're not sure what's still causing you to have your symptoms, and you need clear step-by-step guidance and recovery processes based on a proven process, and that guidance and support and education to walk you through that. So if you're struggling with autoimmune disease, reach out to us or comment under this video, to reserve your spot for next autoimmune recovery program. And let me know if you have any questions about anything that we just talked about, what I just talked about. Okay. So it doesn't look like I can see who's here. Okay, so it was great seeing everybody. Thanks for tuning in, and I'll talk to you soon.